African countries, including Tanzania, is facing a human resource crisis. And the challenge is on the two perspectives. First, there are few staff, that in terms of number, quantity of human resource, but there is also poor performance of the existing human resources. So the perform intervention was designed in order to address the second problem, that is ensuring the performance of existing human resource. So we designed interventions to strengthen the capacity of the district health managers so that they can improve the performance of health workforce in the country. The interventions were implemented for 4 years. This included the baseline assessment, trying to assess the situation, but also designing interventions to address the workforce performance, monitoring those interventions, and supporting the CHMT to design and also implement strategies to address those problems, but also supporting them in doing evaluation to see what changes has happened. There are some changes, improvements in terms of management strengthening, as well as in terms of performance of health workforce. Researchers worked with the district health managers to build their capacities and also mentoring them and coaching them. So we did not work with the providers, we worked with the managers. So it's the managers who, through our coaching, through our mentorship, then they started to change their practices of doing supervision. It was evident that there have been changes in terms of the quality and the quantity of supervisions which are done by the district health managers. It was reported that because of performing interventions, the managers were now able to change the practices of supervision. And this was also evidenced by the interviews we did with the health providers. They reported changes in the nature of the supervisions. In the past, supervisions used to be like inspection for the health workers. But now the CHMT, now the district health managers are conducting friendly supervision, and this was really appreciated by the health providers. The health providers gained, through the supportive supervision provided by the leaders, they gained new skills which were used to improve the qualities of services. In all the 3 districts which we were working with, they selected few service areas. For example, in Iringa Urban, they selected the improvement of quality of CTC services. So throughout the implementation of the perform projects, there were changes in terms of the quality of CTC services. For example, they renovated some of the buildings which are used to offer CTC services. They improved the equipments for CTC services. They improved the procurement of drugs for people living with HIV/AIDS, but also improved the knowledge and the skills of health providers. The same for other districts like the Mufindi, where they were focusing on HIV prevention. So there were changes in terms of awareness for HIV, improving distribution of condoms as one of the key aspects to prevent HIV/AIDS, but also improving the knowledge of health providers. In the Kilolo districts, they were focusing on increasing antenatal attendance. And it was reported that when we were doing evaluation, there were changes in terms of the antenatal visit, but also people attending the first visit in a proper time compared to the past, where there was a problem of delayed first visit to the antenatal services. Perform did some strategies to at least ensure sustainability of the projects. First, what we did is to ensure that the kind of interventions which the districts were implementing are being integrated in their district annual plans, and they are being implemented using the existing resources coming from the government. So Perform project did not come with additional resources. So what we did is just to give them capacity so that they can be able to identify those problems and include them in their actual plans and be implemented using the government resources. So we are sure that the district health managers, they are going to sustain that efforts because the government is continuing to give resources to implement the activities. But also we decided to involve the regional health management team. The regional health management team, these are the supervisors for the 3 districts we worked with. So we are sure that by involving them, they are going to reinforce the activities we were doing, at least to take them forward.